My name is Dr. Doug Nemisek, and I'm a psychiatrist and the Chief Medical Officer for Behavioral Health at Evernorth Health Services. Today, we're going to be talking about behavioral health and how it affects your employees in highly personal ways. We realize how important it is for you to stay up to speed with what's happening and what may come so that you can make informed decisions for your workforce and your leadership, as well as designing your own culture of health, which we all know needs to be inclusive of behavioral health. We know behavioral health is essential to overall health. And we also know that more and more employees are really battling mental health issues these days. We've been listening and we've heard about all of these challenges. Your employees are depending on your support and behavioral health offerings, but oftentimes we hear they don't understand what's available to them or really how to access the support. We've also heard you're witnessing firsthand how behavioral health is impacting your workers' well-being and productivity and ultimately creating lots of stress and burnout and turnover across your organization. So today, I'm joined here with Jason Youngblood, the Behavioral Strategy Senior Director and Clinical Leader at Cigna Healthcare. He's focused on Cigna Healthcare's behavioral health solutions and how we're best positioned to support you and your organization. Today, we're going to talk about the current state of behavioral health in the United States, as well as what you and your employees can do, what your employees can expect from you, how behavioral health is impacting overall well-being and productivity at your organization, and how we at Cigna can help you help your people. So Jason, welcome. Thank you so much for joining me today.
Thank you for having me. It's great to spend a little time with you here.
Absolutely. You know, Jason, we have seen a real big increase in the amount of behavioral health conditions and concerns across all of our clients and really seen it in the news and across the United States in general. Every single one of us was impacted by COVID over the last few years, and we've seen a dramatic increase in the numbers of people reaching out for help. That includes kids, teens, and adults of all ages. We used to say 1 in 5 adults had a mental health condition in any given year, and now that's even 1 in 4 of us as adults. And unfortunately, a lot of our studies here shows that 50% of people with a mental health diagnosis aren't getting any treatment at all. People are concerned about how to access care. In markets, we hear about wait times, sometimes of weeks or months, but people need help. And the stigma out there still exists a little bit around mental health and substance use disorders, which leads to just too many people avoiding care or delaying reaching out. So Jason, to kick us off, tell us a little bit about what you're hearing from clients about the behavioral health issues they're facing. How do we see this impacting organizations and ultimately their bottom line?
Yeah, absolutely. Some sobering statistics that you just walked us through. 1 out of 4 of us are impacted by a behavioral health condition. That means all of our listeners today, both of us are impacted in some way. I myself have anxiety disorder, and so I can relate to those out there who may be suffering. 50% of people with behavioral health diagnoses never get access to care. And that long wait time in order for people to get the care that they need, I believe there was a recent study that just suggested that from the onset of symptoms to successful engagement, it can be up to 11 years. That's a lot of people out there who are suffering silently, and they don't just have behavioral health conditions. Sometimes they have multiple conditions. They may be suffering from depression and dealing with some substance use disorder as well, but they're probably also suffering from medical conditions. And we know that people with both medical conditions and behavioral health conditions, they tend to utilize more medical care or spend more money on medical care overall. According to Millman, they're 3 to 6 times more costly. But in addition to being more costly and suffering silently, what we hear from organizations is that they feel that impact behind the scenes as well. Those folks maybe are more absent, or maybe they're present at work but not technically engaged. And I think that places an additional burden on the entire organization. And in general, it's contributing to fatigue and malaise in the workplace. Burnout is one of the top issues that employer groups across the country are talking to me about. So as you so nicely opened this up from our perspective, what we're seeing is that employer groups are on the front line of the mental health epidemic, and more people are turning to the workplace for help and support.
I hear that too when I'm talking to employers and others out in the community. Employees are really looking to their employer for support. We know employers are really looking to figure out how do they offer those supports and how do they help individuals really make that connection and figure out where to go. What are some of the things that employers can do to really improve access, to help their employees be more knowledgeable and understand more about what's available and how to get help and how to decrease some of that stigma and awareness and silence that we face around these kinds of conditions?
Yeah, it's a great question. And the studies that have recently been coming out do reflect the employer's experience around this. 50% of individuals surveyed who have left a job report they've left for mental health reasons. And that's up from 34% on the same study that was conducted just 2 years prior to COVID. And we're seeing additional studies that show that the majority of workers are placing the responsibility for mental well-being on the employer. They're expecting the employer to address it. The good news here is that more people are viewing getting care more favorably. And to the point that you were making sure that people have access to that care, making sure that people are aware of the benefit really is key and critical. That seems like it can be an overwhelming or a monumental task to take on. However, I recommend just picking a place to start and taking it one step at a time. The first thing an organization can do is demonstrate a commitment to mental health on all levels. I think it's important at the very top, all the way down to frontline managers and frontline employees. The words that are used really have to match the actions that are taken and the culture of the organization. So kind of paying attention to not only what you're stating, what you're committing to, but how does the workplace culture support that? And that really brings up the concept of health literacy. And from my perspective, we've had the most success in helping organizations drive health literacy or awareness of benefits, awareness of mental health and behavioral health by focusing on those within the organization whose role it is to take care of other people. That's their formal job. Those are your HR team members, your benefit team members, wellness champions, whether they're formally a wellness champion or they do that off the side of their desk, but also frontline people managers, and pay special attention to them to make sure that they have the education, the knowledge of the benefit and the resources, as well as the vocabulary necessary to speak about behavioral health conditions.
One of the other pieces that I want to kind of pull back on a little bit that you mentioned earlier is the important fact that we understand that people don't have just mental health conditions or just physical conditions. We all have multiple health conditions and concerns going on and all at the same time. And one of the things we do spend a lot of time on at Cigna Healthcare is really making sure we're taking that whole person approach to behavioral health and physical health all together. Tell us a little bit about how Cigna Healthcare really works with clients and how we can really bring to that whole person care approach to bear to help make sure that everybody has the opportunity to be their healthiest and function their best.
First, our employer groups aren't alone. There's a lot of work and it can feel like an overwhelming task to accomplish. And at Cigna Healthcare, our engagement teams are aligned to clients across the country, and they do partner with our benefits team to drive awareness on an kind of creating an annual calendar of events, pushing materials monthly, providing materials that can be distributed and used by workplace, as well as helping to plan and conduct events to drive literacy and awareness. My team are a team of licensed behavioral health clinicians, and we are aligned by market and to our organization as well. And so think of this group, we're a group of therapists and social workers, psychologists. We don't see individuals, we partner with organizations. We learn about what their challenges and goals are, and then partner with them as well as our engagement team specialists to really drive improved behavioral health and well-being to improve whole person health. And so you're not alone from, helping to address culture in the workplace and help promote literacy and understanding. The second bucket is really that integrated benefit design. We can't separate our body and our mind. The vast majority of people with behavioral health conditions do have overlapping medical conditions, as you stated. And the clues to behavioral health needs show up, here at Cigna Healthcare. It shows up in our medical data, shows up in pharmacy data, our dental data as well, even vision, not only in the claims, but also in our interactions and customer service in each of those respective areas. So we have connections built across all of those different areas: medical, pharmacy, dental, our employee assistance program. If somebody is calling in, maybe it's not about a behavioral health issue, but through claims, through kind of engagement and learning, we're prepared to identify and get them connected to that support. And so we're looking for, not only the 50% of folks who likely will step forward to get care and support that you referenced, but we're looking to get to that other 50% and to help get them engaged and connected and dramatically reduce the wait time that people are facing out there today.
I'm really excited about some of the advances we've seen, especially driven and accelerated by the pandemic and our need to really leverage digital resources and virtual care in new ways. And we've really been able to add to that in behavioral health with a broad network now of behavioral health care providers and therapists and programs and convenient access so that individuals now can get that quick access to care in the way and at the time that it's best for them. And this really helps lower the stigma, make it more convenient, and really improve even the concerns about privacy and some great things that we're seeing in the behavioral health world to help support this whole person care approach.
Yeah, absolutely. Behavioral health is full person health, and we've been in the business of supporting behavioral health and well-being and whole person health for a while. And in this post-COVID environment, the world of behavioral health is blossoming, and more people are interested, concerned, and talking about it. And it is a privilege to work out there with the employer groups that we work with to help drive improved behavioral health and well-being with all of our programs.
Yeah, Jason, there's so much we could talk about probably all day when it comes to whole person health and the importance of behavioral health. But for now, I want to just thank you for sharing your insights about behavioral health, how it's truly essential to overall health for all of us. Mental health and substance use affecting patients in really personal and unique ways. Here at Cigna Healthcare, we know it's crucial for all of our clients to understand the overall behavioral health landscape, different care journeys their employees are on, and the importance of offering that robust and comprehensive behavioral health network and resources to support all of the complex needs for their employees.
Yeah, it's so true. And thank you, Dr. Nemcek. It's so happy to have had the opportunity to hang out with you for a little bit. And also happy that so many of the organizations that we support and partner with are seeing the value in our behavioral offerings and how they can help them keep their employees healthy and well and grow their organizations. As consultative growth partners, it's our job and our responsibility to better understand how our clients are experiencing the rapid changes in the behavioral health environment, the pain points, and really work together and partner with us to address them and find solutions. We know it's important, and it is a big part of the overall journey in keeping organizations well.
Absolutely, Jason. Thanks again for joining me. And to all of our listeners out there, thank you so much for tuning in and being such a valued partner with us. We really look forward to sharing more information like this about the importance of behavioral health with you in the future.